Hello, everyone. Today, one more time, I request all of you to stay at home, stay safe to prevent coronavirus from spreading. Today's topic will be diabetes, or in medical terms, diabetes mellitus. There are 3 types of diabetes. Type 1, lack of insulin production, which is seen in children and adolescents. Type 2, increased insulin resistance, or decreased insulin production, seen mainly in adults and elderly. Type 3, gestational diabetes, seen in pregnant women. Some more causes include genetic disorders, pancreatic diseases, drug addictions. Keeping blood sugar levels at check is must and should, or it may lead to grave cardiovascular complications, high blood pressure, heart attacks and strokes. Impact on eye will be permanent loss of vision. All of the above mentioned complications can be avoided, which is possible by 1. Monitoring blood sugar levels regularly. 2. Follow a strict diabetic diet, and 3. Practicing yoga and exercises regularly. This article is written by our specialist, Dr. Medhawe Agrawal. Our medical experts will answer your questions related to your health concerns. Please subscribe to my channel to stay updated and to get more information on daily healthy trends, concerns. Click on the bell button to subscribe. Stay healthy. Thank you.